Hi, our names are Andrew and Christina, and this quarter we've been studying brain stiffness and myelination in Alzheimer's disease pathology.
Alzheimer's is a form of dementia that affects more than 10% of people ages 65 and older, and it's been subject to extensive research, yet few effective treatments have been found.
The hallmark pathology that most people think of when it comes to Alzheimer's disease, or AD, is the buildup of tau proteins and A beta plaques in the brain. As a result, this is where the majority of therapeutic efforts have been made. Unfortunately, therapies involving removal of these anomalies have proved little success.
There is, however, a growing interest in the role of myelin in AD, which is the material that makes up the majority of white matter and insulates axonal signals to promote healthy cognitive function.
As a review, oligodendrocytes and Schwann cells are the glial cells that are responsible for forming myelin sheaths around axons in the central and peripheral nervous
But in
systems.
AD patients, we see oligodendrial damage, which leads to the observation of an excess of myelin damage in the central nervous system in AD patients.
From a mechanics perspective, an experiment in 2016 has shown that brain stiffness increases with myelin content, which we can see in this graph showing a positive relationship between myelin content and stiffness. This mechanical observation has been extended to AD, in which an experiment in 2011 measured the stiffness of live AD patients' brains with magnetic resonance elastography. They hypothesized that the buildup of plaque and tau proteins would increase brain stiffness. However, the patients with AD have consistently and significantly less stiff brains than people of similar age, as seen in the graph on the left. We hypothesized that this decrease in stiffness could actually be due to the lack of myelin in AD patients. This hypothesis would help explain the variance in elasticity in the brain cross-section in the graph on the right, because demyelination begins in the regions of the brain that myelinate later in life and spreads to the other regions that myelinate earlier.
Having shown that myelin plays an important physical role in the brain of AD patients, it follows that targeting myelin could be a promising therapeutic pathway, with some studies already showing positive results. One interesting study is using cinnamaldehyde, which is actually the main chemical component, which has been shown to promote myelination in the peripheral nervous system. But when given to mice with model Alzheimer's disease, it actually improved their cognitive function and reduced A beta plaque buildup, which is shown in green in the figure.
Another study used shenziling, or SCL, a combination of 10 herbal Chinese medicines, and compared it to a model group with model AD, control group without AD, and a donepezil group, which is a medication on the market that inhibits cholinesterase for memory improvement to treat AD. As seen in the graphs on the right, SCL showed improved cognitive function with the maze test and was comparable to donepezil. Additionally, amyloid beta proteins were decreased in the SCL mice, as seen in the graphs on the right. Although studies in myelin and AD are limited, seeing that myelin has a large mechanical impact in AD, and with the promising results of the studies that have been directly targeted at myelin in AD, we find that myelin-focused research and therapy paths could be a promising way forward.